Hello, everyone. This is Dr. Isabelle Amigues from UnabridgedMD. I'm your friendly rheumatologist, and we are here in a very special episode for me. This is another episode of our podcast on UnabridgedMD. And today we are going to hear from one of my dear patients that I think I can call friend. Lisa came to me about 3 years ago, and you're going to hear her story, and it's going to give you so much hope. So if you're listening to this while you're not sure what you need to do, what you have to do, or if there is any hope in your health journey, please listen because you're going to be uplifted by the story. Lisa, thank you so much for coming on the podcast. As you know,
It's my honor.
yeah, thank you. It's hope driven by science. And so the science is me, the hope is you in this episode. And I'm going to ask, I'm actually not going to talk much today because I want you to tell us your story. What's your story? You don't have to go into details, but maybe how you felt before you
Yes.
came. Yeah.
You know, I actually have multiple chronic autoimmune disorders. However, I did not know that's what it was. And I reached a point in my life where I had no hope. Nobody knew what to do, and I didn't know what to do. And I had a dear friend recommend Dr. Isabel to me, and she created a life for me and a quality of life and discovered so many things on this journey that her and I have been through together. And I now have hope.
Thank you. Thank you so much for sharing this. I don't necessarily want us to go in detail, but we can.
Yes.
I
Yes.
you know
Ah,
what we're trying, and thank you so much,
it's
Lisa.
joy. Mm,
And it means so much to me. You know how much it means to me.
yes.
What I'm trying to share always, right? And I love the word hope that you used, is
Yes.
I feel like you didn't know where to go when you first came to see me. And I think
Yes.
one of our common, like one of my patients who is your friend was like, what was the thing that made you think maybe this is autoimmune, or let me just go and see Dr. Isabel? What was that?
I was having I was having a discussion with him who has autoimmune and has been a patient of yours for years.
Mhm.
And I was describing symptoms that I was having and abnormal labs. And nobody could figure it out or piece it together. They weren't looking. And he smiled at me and he said, I have that person. And he actually called you on the phone at that minute. And you talked to me for about 15 minutes. And that very next week, I had an appointment and got to meet you. And the journey that you and I have been on has been very complicated. I have a very rare disease called Behçet's disease. And with that, it affects pretty much every organ or process in your body. And you started from square one because we didn't know where to look. And you had an open mind. You have a very holistic approach as well. And you kept me centered. And you kept giving me the pep talks that maybe, okay, that wasn't the answer, but guess what? We're going to look here. And you referred me to all of my specialists, my neurologist, my nephrologist, my gastroenterologist, and you. And oh, cardiology. Boy, can't forget that one. And we have come up together with the collaboration that you have with other physicians, because people who come to see you are usually multidisciplinary.
Mm-hmm. Yeah, rheumatology.
And I appreciate that you take that time, because what you do comes from your heart and you truly are seeking the answers. And this became a journey for us. And now, because it's a lot, I am being treated at National Jewish. And we are going to continue with you, because your hope and your smile and your pep talks and your encouragement and your dietary suggestions, lifestyle suggestions, your calmness, that kept me going this last 3 years.
So you mentioned something for, first of all, thank you. And it's my honor. Like Lisa, it's such an honor. You know how much I love my patients, and it's such
Yes,
an honor. And I think
yes,
I know it's direct care, I know it's different, but it feels
mhm,
to me that patients are choosing me. And so
yes,
I'm choosing my patients, they're choosing me, and I just
yes,
love that, right? So
yes,
there's a lot of love for sure. You know, you said that in your story before we met, that you kept going to different people. So it's not
yes,
that you didn't see different specialists, because then
yes,
after that you said, well, you referred me to different specialists. Um,
yes.
it's like I want to, because very often patients will come to me and say exactly those words, which is, I've seen so many
Mhm,
doctors.
yes.
And what was that feeling? What was the feeling then?
It was a feeling of nobody had answers to what my results were. And their responses got to the point where one of them, actually two of them, stated that I was a hysterical woman who perseverates on her ailments and would benefit from psychiatric evaluation. And that was their dismissal. And that's where I was at when I was talking to my friend, because the reality is I live in my body and I live with my symptoms. And test results were abnormal, but why? And nobody looked into why,
Yeah.
or what's the best medicine for what we've got going. And so it became a dismissal of, it's all in my head. And when I came to you, you listened and you heard me and you told me it was not all in my head. And that right there was the start of the hope, because I began to believe what I was experiencing was truly just all in my head.
Thank you, Lisa. You know, I wanna, you know, this is a podcast, and I wanna share a little bit of doctors' knowledge, right? There's the knowledge scientific, and then there's the knowledge of just how the system works. And I'm gonna tell you a story. I love stories. I have a very good friend of mine, psychiatrist. She became a psychiatrist, but at the time we were both medical students. And I was in the internal medicine rheumatology department, because I've loved it since day one. And here was this young patient, and he, like, no one could figure out what he had. It was all over the place. He had severe pain, and I started telling my friend, I think he's crazy. It's all in his head. So I was, in my early 20s. And she says, Isabelle, that is not a diagnosis. What do you think he actually has that is psychiatric? So I want to pause just here one moment. Sometimes in medicine, physicians don't know. And they are like, especially in the insurance world, where you have to do numbers. You have to go from one patient to another, to another, to another. You have to fill forms. You have to respond to phone calls. You have to review the labs, the x-ray. Like it's a lot. And sometimes, like the young, physician in training that I was, you're like, no, I think it's all in his head. They're crazy, right? And that pause for me at that moment, whenever I'm thinking, I never thought of this with you, but I think for people who have been dealing with this, and there are so many, because sometimes the physicians are just like, I cannot help you. It has to be in your head. Go and see a psychiatrist, right? And so then they are like, why are my patients so upset when I offer them psychiatry? You're like, hold on, because you didn't offer them the right way. And I always pause, and I'm always wondering, okay, so I think this is potentially psychiatric. What is it? So for example, one patient, then later on, maybe like 5 years later, I have a patient that's coming in the hospital in New York City, and my resident tells me she's crazy. And I paused and I was like, what is the diagnosis? And you know what? That patient was fully confused, super potentially fatal, like she could have died of this. She had cut her benzodiazepine. She had cut her Xanax that she had had for many, many years. And one day she was like, no, I don't want to take this anymore. She stopped it. And the problem, and for a PSA, right, public service announcement, when you're on benzodiazepine for a long time, you want to be very careful of how slowly you're decreasing that, because otherwise you can be confused. And if I did not pause and think, what is the psychiatric condition here? And it was like, this is confusion. She's confused. That's actually in medicine, delirium, confusion, right? And it was acute. And so then you're looking at all of her medicine and realizing that she had we called the pharmacy. I remember calling the pharmacy. She's like, yeah, this is the medication. And I'm like, why did she not have this medication on? We put her back on benzo. She's totally normal. Right? And so this is really important. If someone tells you it's all in your head, you have to look at them and say, what do you think the diagnosis is in that case? If it is all in my head, I'm absolutely open for this. What is your diagnosis? You cannot just dismiss. So this is important because it's a way to engage them, saying, okay, you think this is psychiatric, but like, is it acute? Is it chronic? What do you think this is, right? And you are complex. You have a complex medical condition, for sure. That is rare. What's so interesting is the way you presented. I remember thinking this is clearly not psychiatric, but neurologic. Remember?
Yes.
And I think we fixed that part pretty fast, thanks to the neurologist. I'm not a neurologist.
Yes.
But it's so important to me that people, I mean, it's already hard to be a patient. And to be dismissed and gaslit is like probably the worst feeling in the whole world. And so if you are hearing this and you've been gaslit, or dismissed, just remember, if they ever tell you, if you think that this is psychiatric, ask them, okay, from, what is the word? DSM-5 or something. It's like a psychiatric, you have like different diagnoses in DSM. Okay, what do you think this is? Like, if you think this is psychiatric, what do you think this is? Like, I'm totally open for this. What do you think this is? And now you're going to refer me. Who should I see? This is important. I think that this is important to pause people and be like, okay, well, if this was not psychiatric, what do you think this could be? Who should I see next? Like, yes, I'm willing to be open that maybe there's some anxiety here. If you think that there's something open to listen to this. And now help me figure out my next step, because once you've told me it's all in my head, like, how do we help me?
And that's where I was at. There was such desperation at the beginning. I'm an ER nurse. which is a very active physical brain thinking, and it was gone. And going from that to the disabilities that come with a lot of conditions that you help. And it took me out of that world into an unknown world of learning how to sit, how to rest, how to eat the right foods, how to find your mental health, whatever that is, to find support groups. The availability that you gave me when something was happening to be able to contact and get a hold of you was such a lifeline. And again, with all of the numerous doctors and tests and waiting, and it's a journey. It's a journey that you're going to be unfamiliar with. But you come out on the other end with that hope because things come together, and lifestyle changes and medications and therapies, they all come together. And you do reach a point where you have a quality of life. I am an example of chronic conditions, and here I am. And it doesn't have to, and this is probably the hardest part for me because this is how I look, does not indicate how I feel.
Yeah.
And the psoriatic arthritis is in a flare right now. And joint movements from my shoulders to my ankles, my hips, walking through the grocery store, trying to reach up on the shelf to grab a can. And people will look at you. And because you look good, they don't understand what's the journey inside. And that is going to be the most difficult thing I believe that I've had to deal with. Because doctors don't even take you seriously if you walk in with a smile and look like me. Because I'm not curled up on the couch. And guess what? Don't curl up on the couch. Put pink in your hair. Go do that drive. Go take that trip. Because there is hope. Because that's what's out there. And that's what Dr. Isabel gave me.
Thank you. Oh, I don't think I have anything to add. Thank you, Lisa.
Mm-hmm.
You brought so many potential topics. The silent disease, where,
Mm-hmm.
as you mentioned, it's invisible, right? That people
Mm-hmm.
see it.
It is.
And
It is.
it's so important because the fighting that you would want to have
Mm-hmm.
against your body is we don't want that. We want to take care.
Yes.
We want to take
Yes.
care of that body. We want to take care of that mind.
You do.
It's such an honor, Lisa,
Yes.
to be your
Thank you.
such an honor. Such
Yes.
an honor to interview you in this, and
Yes.
you know we are, again, we are still in the process. Like our goal, our goal in rheumatology is to achieve full remission.
Yes.
We've got the quality of life, but my goal is
And
still full remission.
we're still
You know?
working on it because
Yeah,
this is
and
a
we've
tough
had
one.
it.
But
We've
we're
had
gonna get there.
we've
We're
had
gonna
it.
get
I
there.
remember we've had it, and
We
then
did.
that's the
Yes.
issue with some chronic conditions, when it's, especially when it's complex and it's not just one. It's
Yes.
you reach remission, and then there can be flares, and we have to work
It can.
closely.
And
You know,
that's what you do. And you
yes,
get through the highs and lows with your
Totally.
patients
Yeah,
because you've got treatments available for
and
when you're going through the bad.
and I'm gonna say this because I think I wanna share hope. Like this is the biggest thing for me, is that in a way I wish we had seen each other earlier, right? Like because
I do too.
the earliest you get like the autoimmune disorder, the earliest you um, look at it, the earliest you diagnose it and treat it, is
Hmm.
also the faster and the longer. Like you can actually get patients into full remission,
Yes.
and there's less risk of coming out of that remission, right? And so,
And less damage to
yeah,
the organs
yeah. And
while
so
you're going through it.
if you are listening to this podcast, right, and that you're wondering, I would highly, highly recommend go and see a rheumatologist. Even if you don't know, if you have this
Yes.
intuition, something's off, no one can piece it
Yes.
together. That's very often where personally I shine because I can put the pieces together. I can
Yes.
figure it out. And then
Yes.
from there, we go to full remission. And the
Yes.
longer you wait, the harder it is to, like,
Yes.
it's easier to make a diagnosis, but it's harder to get to full remission. So achieve disease remission as fast as possible. That is really of utmost importance.
Which
Um,
means getting to you faster. Don't wait.
yeah, thank you, Lisa. But yeah, we are at the end of our podcast. I want to thank you so much,
You're
Lisa,
welcome. I'm
for
available anytime for anything you need.
you are amazing. And to the patients out there that are listening to this, or if you have a loved one that you think may benefit from a rheumatologic evaluation, I'm available. I still see new patients, and I would love, and it would be an honor to be on this health journey together. And like Lisa, let's get some hope for you and let's make it happen even faster. Okay.
Yes.
And Lisa, I think you started with my practice almost at the beginning. So I didn't exist. UnabridgedMD did not exist before. But now
I
I'm
am so proud of you.
Thank you.
I am so proud of you. And I'm grateful that you do the podcast and that you are available and that you are doing this.
Yeah,
So thank you.
thank you so much. And everyone, thank you. And I'm pretty sure, Lisa, that everyone that's listening right now is thanking you for being so vulnerable and sharing your story.
Thank you.